We need to be careful with the term because a facelift means many, many things. We can do very minimal surgery, and we call it a facelift, or we can do more extensive surgery depending on the degree of aging and the problems that have arisen. So for example, in a younger patient in perhaps their 40s, patient comes in and they're most concerned about the neck. The rest of the face looks quite good. We can limit the surgery to a small incision under their chin and accomplish a significant improvement in the neck and the jawline without incisions in front of the ear, behind the ear, and without a more extensive procedure. On the other hand, if the patient comes in having spent a lot of time outside, deep wrinkles, a lot of skin excess, or that patient has lost a significant amount of weight, those patients need more extensive surgery. So the degree of surgery really is dictated by the degree of facial aging. If we do a classic facelift, then recovery, I tell the patient, is going to be about 2 weeks. Not because they're in pain for 2 weeks, but just because they're going to bruise and they're going to swell. Generally, what I tell my patients is if they've had a traditional facelift with the incisions as I've described and a fair amount of work, the first night's going to be tough. The afternoon of the third day is what we call hump day. That's when everybody magically starts to feel better, the afternoon of the third day. And then from day 3 to day 10 or day 14, they're really just recovering from bruising and swelling. So they're able to go about their business at home, but they're probably going to want to have some time off. So I tell the patients, again, with a standard facelift with incision in front of the ear, significant amount of work, you're probably going to want to take off 10 days to 2 weeks.